In a formal abdominoplasty, I do the same skin excision as I do in a moderate abdominoplasty, but basically put in an internal corset-like suture. Really, if you can imagine a shoestring being put in the outer surface of the muscles of the tummy wall and then tightening that down, that actually corsets or pulls the muscles together. And that is really what is necessary to be called a formal abdominoplasty. That because it's a stitch in the area of the gristle tissue of the muscle, it tightens what has been stretched out by childbirth and delivery. Really, a lot of women come to me having done their 50, 100, 1,000 sit-ups a day and still say that in spite of that, they can't get rid of the skin and the loose skin especially, nor the fat of their tummy, and that when they let their tummy go, the whole stomach muscle complex falls forward. That's not because their stomach is weak, it's because the muscle or gristle tissue around the muscles has really been stretched out by pregnancy and childbirth. There's no real answer to that short of a surgical procedure. And women typically come to me having done all the exercises and work necessary to accomplish that. They've done all their sit-ups, they've tried as hard as they can, but they're here to see me to get their abdominal skin removed because of stretch marks and fat, and also to have the muscle tightened. Certainly 75 to 80% of women that come for a tummy procedure end up with a formal abdominoplasty. Rarely a mini or moderate abdominoplasty will apply. This is an operation where, especially when we tighten the muscle, we ask the patients not do heavy lifting, more than a gallon of milk, for 10 days. Time off of work is different depending on what kind of a job you would do. Clerical people can be back within a week or two. Factory workers or people who have to lift or throw heavy materials are off for 6 weeks with this procedure while that muscle gristle tissue heals. The other complications of general surgery and of anesthesia are well documented in our informed consent packet that you'll go home with today, and we'll be able to show you photos of before and after pictures of patients who have had mini, moderate, and formal abdominoplasties.